Yesterday, we talked about ways to organically attract more and better patients. Today, I want to talk about paying to attract the patients that you want. Stay tuned. Welcome to another edition of the Saturday Patient Attraction Podcast. Now, when we first started these weekend podcasts, I told you there would be more technical in nature. Today certainly is going to bear that out. Now first, let's talk about the basics of pay-per-click advertising. We see on average 25 to 40% of new patient phone calls come from pay-per-click. And the important thing with pay-per-click is to understand that it's seasonal. It's not something you set it and forget it and just let it run all times of the day, all weeks of the year. I've seen instances where a doctor pays $5 a click versus $158 a click based on just a couple very small changes in their campaign. What a lot of dentists don't realize is that the same way you optimize your website for organic optimization, you also have to optimize for pay-per-click. Google has a Google tax, as it's lovingly referred to. It's what's called quality score. And quality score is Google's measurement of how relevant what you're advertising for is to what ad and what landing page you are presenting to them. Now, Google assigns a quality score to every ad campaign that you create. And it's a rating of 1 to 10, with 5 being kind of the benchmark. If you have a quality score of 1, your cost per click is increased by 400%. A 2 is a 150% tax. A 3 is a 67% tax. 4 is a 25% tax, and 5 is the benchmark, like I said. Now, if you go over 5, you get a decrease by 16% from your cost per click. A 7 is a 28% decrease, 8, 37.5%, 9, 44%. And if you have a 10 quality score, the best rating you can get, you get a 50% discount off the cost per click that you buy. So if you optimize your campaign really well, you get twice the number of clicks for the same amount of money. Now, what does this really matter to dentists? Because frankly, it affects your bottom line. If you've got 2s and 3s and 4s as your quality score, you're paying exponentially more than your competitor down the road. Now, how do you maximize your pay-per-click? How do you find out if you've got good quality scores or not? Well, first off, whoever's doing your pay-per-click should be able to give you a report and show you exactly what your quality score is. I'll give you one tip. If the person doing your pay-per-click does not have access to edit your website or is not editing your website and optimizing it and creating super relevant landing pages, your quality score probably sucks. You've got to create calls to action on your landing pages too, because it's too expensive to market to the same person more than once. And what I mean by that is email marketing's free. Social media is free. Capturing somebody's personal information, their email address, and continuing to follow up with them down the road is exponentially cheaper. It's completely free to once you've got it set up and running, and you can continue to remarket to these prospects down the road. So how do you attract new patients? Well, you've got to dominate your local market area. Things like local places, the maps, citation consistency, and Google reviews are paramount there. AdWords pay-per-click, optimizing your YouTube videos, which are also going to have a big impact on your organic ranking. You've got to be producing fresh, unique content constantly. If you want good organic rankings, you can optimize things like your website, press releases, Facebooks, major directory listings, as well as maybe you have a book that you've written or somebody's ghost written for you that you've got on Amazon. Now, I know all this sounds complicated. To get a copy of my Townie presentation and much more, text the word attract to 502-442-2513. Now, this sums up the end of visibility, our first pillar. Tomorrow, I want to come back and look at the second pillar, conversion. Until tomorrow, keep moving forward.